am Paolo Gisondi. I am a professor of dermatology at the University Hospital of Verona, Italy, north part of Italy. And I'm very happy to share with you the following insights. It is an international project aimed at investigating whether there are some genetic variants that are favorable for the patient to respond positively to the biological therapy, either alone, either in combination drug with two different biologics. And this is a very wide project because it's not only for patients with psoriasis, but also patients with other immune-mediated disorders such as rheumatoid arthritis, psoriatic arthritis, but also IBD, including Crohn's disease and rectocolitis, ulcerative colitis. So it's a huge project financed by the European community and is ongoing, of course, and the major aim is investigating the genetic susceptibility to response to biologics. Comorbidity is a big problem, a big issue in patients with psoriasis. Firstly, they are very common. For instance, fatty liver affect approximately 50% of patients. Psoriatic arthritis affect up to 1/3 of patients. So dermatology face these clinical issues in their real life. Firstly, comorbidity, metabolic comorbidities are cardiovascular risk factor. Indeed, patients with psoriasis have an increased risk of mortality for cardiovascular risk factor. Thirdly, it's very important to intervene also on this comorbidity from the general practitioner, from the dermatologist, and to promote lifestyle changes, for instance, weight reduction in obese patients, in order to improve the health profile of the patient, improve comorbidities, and also these have a favorable impact on the response to systemic treatment, including biologic. One of the major unmet needs is the access of patients to therapy, to effective therapy, to safe therapy for long-term management of psoriasis, and also that this accessible is sustainable for the health authorities, for the community. So it's very important to shorten the time that the patient with moderate to severe psoriasis achieve a systemic treatment, and it's very important that the disease duration is short. Why? Because this improves the response to treatment, and this could potentially modify the course of the disease. Then the system should be sustainable on long term for the community, and these biosimilar drugs are a tool to achieve, to favor this sustainability because of the low cost, but biosimilar are not affecting all the patients, and so we need other drug with other mechanism of action and with other safety profile that could be effective in the more severe patient, including patients with comorbidities. Then there is the issues of oral therapy, because they are more convenient for some patients and for other very practical issues. For instance, they do not need the cold chain. That could be an issue for the practical organization of the hospital, and so the new oral treatment are also very promising in terms of efficacy and also safe.